Hello, it's Peter Wright and Kathleen Beauvais with another weekly wrap-up for Health Declassified, and this is coming to you for the week ending 8th of August 2025. First, let's welcome co-host Kathleen. Hi, Kathleen. How are you doing today?
I'm doing great, Peter. Thank you. And thank you also very much for tuning in. We so appreciate having you. So, Peter, would you like me to jump right in to our health tip of the day?
Yes, and I'm going to let the cat out just a little bit out of the bag, and I hope the cat behind you doesn't jump out of his shelf either. But anyway, the topic that Kathleen's going to be talking to you about is one that I have a personal interest in, which will be revealed a little later during this episode. So you go ahead, Kathleen. I'm all ears.
All right, Peter. Well, today I'd like to discuss varicose veins and how they are more than just a cosmetic concern. And this is an article that we got from Dr. Mercola's site, and we will provide a link to that full article here below this video. But let me give you some of the highlights that I found. So they say here that varicose veins affect over 40 million Americans and are often
Wow.
mistaken for a cosmetic issue, even though they signal deeper problems in circulation that worsen silently over time. These enlarged, twisted veins usually appear on the legs. They form when blood begins to flow backward and collect in the veins, increasing pressure and causing the vessel walls to stretch and swell. While many people live with varicose veins for years with minimal discomfort, it could turn into more serious problems, they say, if left unaddressed. One of its complications is superficial vein thrombosis, where a section of the vein becomes hardened, red, and painful due to clotting. In some cases, they say, these clots may extend into deeper veins, raising the risk of a DVT or a deep vein thrombosis, which carries the risk of life-threatening embolism if a clot dislodges and then travels to the lungs. So, some of the symptoms of varicose veins you need to watch out for is a sense of heaviness, often develops towards the end of the day. Pain may shift from dull to throbbing or cramping. Swelling in the lower legs become more common and persistent. Skin changes near the affected veins signal advancing dysfunction. Slow healing and venous ulcers may develop in later stages. Persistent symptoms signal the onset of chronic venous insufficiency. If any of these symptoms appear, they say, seek medical attention. Risk increases with age, hormonal shifts, pregnancy, prolonged standing or sitting, obesity, sedentary behavior, cognitive tissue disorders, and a family history of vein problems or clotting disorders. Treatment options for varicose veins include the use of DMSO, which we've talked about in previous episodes, Peter,
Hmm.
to reduce the swelling and support healing, and inclined bed therapy to restore circulation overnight. Move regularly, they say. Raise your legs during the day. Choose your shoes wisely. So reduce the use of reduce wearing high heels, for instance, and manage your weight. And then they say prevention focuses on daily walking, regular leg elevation, proper footwear, weight control, hydration, and avoiding prolonged sitting, standing, as we've just mentioned, and restrictive clothing that places unnecessary pressure on the lower body. So there you have it, Peter. So just if you think that these varicose veins are nothing to be concerned about and it's just something just a cosmetic issue, think again. There are things to look out for.
Absolutely. No, thanks, there, Kathleen. And when you brought that article to my attention, I thought I'd better do something because I have had fairly ugly varicose veins, more on one leg than the other for a few years. And I actually saw a doctor 5 years ago and was scheduled to have them fixed surgically right at the time COVID appeared. And then, of course, a whole lot of non-essential surgeries were postponed or cancelled, and mine was postponed or cancelled, and I never thought about getting anything done. And they've got worse in the last 4 or 5 years. And then when I read about the article, and I do have a family history. My father had varicose veins, and he had them stripped out. There was a term they used, way back when he was probably in his 50s. And then he also did get a deep vein thrombosis that nearly killed him after
Oh, really?
he was on a horse. He got his playing our game of polo cross, and he got bumped between two horses, and his leg squashed a bit, and it triggered they think that triggered a thrombosis. And he got as soon as he felt pain, he got medical attention. What nearly killed him was his own fault. He was put on warfarin, and he forgot to take a dose one day, so he took a double dose the next day, and he passed out in the bath. And which is a warning to everybody: don't overdose on prescription drugs. If you skip one, then you've skipped it. Just keep going. Fortunately, my mother found him before he slipped under the water, and in those days, family doctors did house calls, and our doctor lived across the road, or very, very close. He came and fixed him up. So that was a wake-up call. So I thought, having read the article, I better get mine sorted out. So
Mhm.
I'm waiting for an appointment to see a surgeon and get them fixed. I'm lucky I don't have any pain. They're really unsightly. They have got worse, and they are getting worse. So I thought it was time to sort them out. So, but thanks to you for reminding me, Kathleen, as
Right.
you often do on medical stuff. So I picked up an interesting one. I'll just go be very quick on this one, and that is comes from Epoch Health, by the way.
Mhm.
A study found that 28% of 53 non-antibiotic drugs can promote the growth of Salmonella, E. coli, and Shigella, which causes typhoid and diarrhea, because they suppress the growth of the good bacteria in your gut, and they allow these bad bacteria to grow. And
Right.
some of the drugs, and these are not prescription necessarily. There's a fertility drug called clomiphene. There's a statin, which would be a prescription, but they're not antibiotic. That's the point. Simvastatin. There's an antihistamine. One or two of the worst ones are antacids, believe it or not, and they talk about Pepsid and another one. The reason antacids are a problem is that they reduce your stomach acid, right?
Yes.
And those in particular allow E. coli and Shigella to flourish and suppress the growth of healthy bacteria. So it's not just antibiotics you've got to be careful of. You've got to be aware that other non-antibiotic prescription and off over-the-counter medications used extensively can affect your gut bacteria. So I thought that was quite interesting.
Yeah, it is. Thank you for that, Peter. That's interesting. Mhm.
Okay. So there we are. You got any more on health?
That's it for me today, Peter.
Well, we have got a new one. We've picked up we're now representing another, as an affiliate, another supplier of organic health products called Touchstone Essentials, and we will be putting more information about that in our newsletter. So watch out for that. They have a really good range of products and a lot of articles and videos, and we're very happy about and looking forward to promoting these. So that was my bit of medical news. What happened on the show this week? Well, we had a guest interview which we published on Tuesday with Susie Kundrat. She's an award-winning author, an energetic wellness keynote speaker, and a registered dietitian and nutritionist. And she's worked with a number of top sports teams and university-level sports teams, helping athletes. What she talks about is eating, moving, and grooving more effectively so that you have a better, healthier lifestyle. And she goes into all three components of that during the episode. So she's a really good one to watch. Coming up, who have we got coming up? We've got, first of all, 2 weeks' time, we'll have Dr. Elliot Justin, and he is representing, or he has a business called myfirmtech.com, and he has developed an apparatus that helps men perform better. And you can read into that what you want, but you need to watch the show to get all the details. It's a very interesting one. 2 weeks after him will be Dr. Jeff Gross, who is a stem cell therapy expert, and he talks about some of the amazing results they're getting with stem cell therapy to repair joints, particularly. He also addresses any ethical concerns that people have about stem cells. And 2 weeks after that, we've got a whole string of doctors. Dr. Lloyd Glauberman, and he has developed a lifestyle intelligence app, and that's a really good one. I mean,
Mhm.
yeah, I don't want my world controlled by apps, but any tool that can help you stay healthy, it's worth looking at. So that's our lineup for the next 6 weeks. And we have a book, of course. We always have a featured author. And our featured author this week is our very special guest, Susie Kundrat, with her book Eat, Move, and Groove. And it goes into a lot more detail than she can give in the short duration of the episode. And I would certainly encourage you, if you're worried about your health or exercise, to get her book and start to live better. And I do think, Kathleen, that's about it from me.
All
Back to
right.
you.
Excellent. Well, thank you again for tuning in to our health tip of the week. And until next week, take care, everyone. Bye bye.
Bye.